right, good afternoon, everybody. Welcome to It's Worth a Shot for the 16th. Today we're going to be going over staff retention and scenario risk assessments. Scenario-based risk assessments. Next slide. So just want to let you know that this is kind of a free-flowing format. So if you let us know of topics that you'd like to know about, please go ahead and let us know. And I'm seeing now on that slide, it says April 13th, but really it's supposed to be our next, yes, we have meetings through Wednesday, April 13th. Our next one will be March 23rd. So if you do have topics you want to hear about it, please put them in the chat and we will go ahead and proceed with that. Next slide. Okay, so my name's Miranda and I work with Mountain Pacific, and I have not presented on this before. So we thought we would introduce you to some new faces with Mountain Pacific. I am going to be talking about staff retention ideas today. Next slide. We all know that this is a large issue in a lot of fields, not just healthcare, but through the past couple of years with pandemic and vaccine requirements and stuff like that. We have saw a lot of staff turnover, not just in nursing homes, but in small practices, at hospitals, like everywhere. So these are basically just some suggestions, some tips. We don't necessarily have answers. If you do a Google search about staff retention, you'll see all different kinds of ideas, but you know, it's an ongoing problem throughout all industries. So we'll just get into it here. So obviously staff turnover is costly and time consuming. It also stresses out the employees that have to work when they're down employee coworkers or shifts aren't covered. Keeping a good employee, you know, is a priority, but leadership already has to do so many other things within a facility that, you know, it seems like taking care of the employee might kind of slip down the totem pole of priority. Not that it's not important, just that there's so many other factors that people need to face at this point in time that it's just not at the top of the list. I could go through and read these, but obviously they're kind of self-explanatory. So we're going to go through the next couple sections and just kind of provide some tips for retaining the staff. Next slide. All right, so a big point is teamwork. So a way to retain the employees is through humor and workplace levity is kind of how I want to put this. So we had an example of there is a home that is doing some games with the staff. So they will hide fake money or they will do different searches or games throughout, you know, the month that leads up to a prize for some of the employees to just kind of take their mind off. Yes, it is work, but also to make it fun. And the idea is not to cause extra work on leadership to organize stuff like this, but you could also pass out the roles and have a different person organize something every so often to just kind of make the work environment less work and a little bit more of a family and a little bit more of a fun kind of, you know, environment. Also, it's a good idea for the leadership to get to know the employees on an individual level. And again, you know, this does place burden on leadership among all other things, but when it's more of a family type environment and when you really care for your coworkers and your upper level management and whatnot, studies do show that it's harder for employees to leave an environment. They'll actually keep a job with less pay that they're happy at than leave for a better paying job because of their relationships within the community that they work in. So that's a nice example of that. You want to make sure that you develop teamwork at every level. So we're not just talking about, you know, for example, in nursing homes, the nurses and the CRNAs and so forth like that. You want all of your employees. So maybe you have some contractors that come in or the housekeeping or everybody. You want to involve everybody on the team from the ground up to make sure that everybody knows everybody and that it's an actual family unit that's there to kind of help, again, like with the familiarity between employees, it does help with retention because you feel more committed to your job as opposed to just showing up for a paycheck. Let's see. Yeah, resolve conflicts quickly is also a very important one because when things fester for people, they tend to dwell on it and then it just makes them more unhappy. And then as the the dominoes fall, they become more and more unhappy as an employee and then start looking outside of work for that satisfaction, which then sometimes tends to be another job, or they end up burned out in their own job because they're doing their job plus dwelling on conflicts that have happened that have not been resolved. Next slide, please. So financial means of keeping employees is not, I mean, it's a great model, but it's not always accessible. But where it's optional, you know, offer good salaries that are competitive with your local market. You know, provide incentives, performance bonuses. It could be in the form of gift cards or, you know, Starbucks cards, just anything, but just an incentive to involve them in the work life, plus, you know, being recognized for behaviors that are good, or setting examples or going above and beyond. You know, having that recognized really does fulfill an employee in their sense of responsibility during a job. You know, they feel better about themselves and then do better about their job. So those are some ideas that you can do. And obviously, you know, celebrate as an organization. So a lot of people do celebrate holidays, especially nursing home, for the residents, but, you know, think about doing something for staff as well that, you know, pulls them in and recognizes them and is for them, not something that they're always doing for somebody else. Next slide, please. So a lot of employees like to know that they're going somewhere or doing something or are productive at something. So adding our offering enrichment options or continued education options, or, you know, kind of above and beyond the norm of what you are required to have your facility operating and running, is nice things to offer to employees to attract them to stay, you know, to allow them to better themselves or to, you know, get new certificates or things like that. While they're within their job, with the idea that, you know, hey, I can move up, or hey, I can gain this new knowledge and now be the subject matter expert of this area, or things like that. So that idea of promoting yourself and also, you know, getting more responsibilities in a productive way is a nice way to be able to retain employees as well. And the next slide. All right, so this kind of leads back to, you know, when there's issues, you want to make sure that you resolve them. But employees that are most satisfied with their jobs are usually ones that have an open communication with their upper management. Like, they feel that they can go talk to somebody and that what they're saying is going to be heard and something is going to happen. And if something cannot happen about it, then at least they're told from, you know, who they are making a complaint to or who they need to talk to, that, you know, I hear what you're saying, I understand what you're feeling. And if you can't do something, then explaining why something cannot be done about it, but acknowledging that there is an issue and that person has the right to have the feelings that they're having about something. So the more open you can be with employees, especially with all the memos that are coming out and the regulations that are being changed, you know, with the COVID, with the vaccines, with everything, people want to be heard because they feel at this point in time that they're just, you know, being told what to do left and right, but they might not always understand why they need to do something and why it's so important that something happens. So making sure that everybody's on the same page and that you always have somebody that you can talk to, obviously helps with workplace happiness. And also, you know, help employees learn to problem solve. So, you know, an upper management can't take all of the problems or questions or everything upon themselves because, again, you already have so much other stuff that you're doing. So you could, like on the previous slide, they talked about having mentors or having, you know, you could have a webinar series on how to help employees problem solve, you know, like looking outside the box, like who you need to talk to. If you're not happy with work, then, you know, what can you do to fulfill that need or how you can get answers, but making sure that you have a way for employees to voice their concerns, thoughts, accomplishments, negative, you know, impacts of things always helps people to move past what they're dealing with. Another is to offer solutions to assist like the work-life balance. So we all know that with staff shortages, people have to work more shifts, which means they're away from home more. They're not really experiencing their time off like they should, or their downtime to be able to recharge. And again, you know, this is kind of a self-cycle problem where if you can keep your employees, then hopefully, you know, or if you retain the employees, then hopefully the shifts are all covered where everybody can have that nice balance between life and work. But when that's not available and people are having to pick up extra shifts, even though we're trying to hire, but there might not just be somebody, there's all these issues like that. You still need to make sure that you have set up a nice life work balance for the employee so they can recharge. Ideas for that, I really don't know. At the end of this, if somebody has a suggestion or whatever, we definitely like to hear them. Next slide, please. All right, employee involvement. I've kind of hinted at this for a couple other ones that I've talked about, but like when we discussed having fun game type things for the employees, or like scavenger hunts, or same thing, like hiding fake money, and then by the end of the week you find out how much you have, you could buy something out of a toy box or something like that. Just fun little games, but you can include the employees in something like that, where again, if they come up with ideas, then they can do it. And we're not wanting something that costs money out of their pocket and things like that, but give them chocolates, or give them an extra 15-minute break, or something, whatever it's in your power. But you can involve the employees in creating a fun environment or doing something fun. And then also, you can involve the employees in, improving the work environment, or improving, what am I trying to say here? So it's not just the employee that's in charge of making sure they like their job. It's not just management's job of making sure the employee likes their job. It is a team effort. And like I said, a family. So the more you can encourage the environment to be more familiar, more, codependent is not the right word that I want to use, but I'm going to say it, when you're codependent on each other, then leaving, it's a little bit harder. It's a little bit tougher of a decision to do. And also, you have to be a little more discreet when hiring your employees. I know that when a vacancy comes up, you want it filled and you want, that body in that place that you can train and stuff like that. But sometimes it's almost better to get the correct candidate instead of a candidate, so you need to be a little bit more discretionary when it comes to that. And a lot of times you can also have, when time is right, you can have other employees possibly sit in on the hiring process, because they're the people that are going to be working with this person, to see if they feel that it's a good fit, that this will now be a part of the family, instead of it just being a strict leadership or an HR capacity, that employees actually get a little bit of a say in who they will be working with as well, because that also makes them more invested in their workplace. And then when you do hire somebody, you want to make sure that they're properly onboarded. That's another reason why a lot of people leave a job quickly, is they feel that they've been thrown to the wolves. They get their job, they onboard a bit, kind of where they feel, okay, I know some stuff, and then all of a sudden they're thrown into the deep end. And sometimes that cannot be avoided. People understand that. But at other times, it really is a gap in the hiring, training, and then, standing on your own conveyor belt of duties. So if you can look at your hiring orientation and then turn them loose on floors, sometimes you could find gaps in there that might satisfy the new hires to encourage them to stay further. And again, if somebody does leave after their new hire, ask them, like, what was it? Did you feel overwhelmed? Was the job not what you thought it was? Just kind of get that feedback to make sure you're not making those mistakes the next time around. And let's see, next slide. Okay, so before we start with Dana, Jill just put in the chat, is there anything, fun that you could suggest for other facilities? Or is there, any ideas or things that have worked for you that you can suggest to the rest of the group? Anybody? Well, I mean, I know
rooms.
we did. Sorry, yeah. I know we did.
I love that idea, especially because it's sort of this, I love language, this double meaning of escaping from your job in order to keep your job and have fun together in team building. I love that.
Okay, so I guess we'll turn it over to you, Dana.
Oh, was somebody about to speak up?
Oh, I kind of came in late on that. So I have an EVS staff, our housekeeping staff, and there are several employees that are from different countries. And so we have a carry-in every 3 or 4 months. And each one gets to bring in the carry-in of what, the food that they make from their country. That's kind of fun. And then we talk about it and talk about where they're from and the food and the countries. And so that's kind of nice.
That's great. And then they get to share a little piece, of something that's personal to them as well, and broaden other people's horizons at the same time.
Yeah. So there's an idea. But yeah, anyway, just thought I'd throw that in.
Thank you. All right. So before I move on to do a scenario-based risk assessment, I think that everybody here, just as a little retention gesture, give yourselves a little pat on the back from me, because you have been working your tails off. And we realize that, and retention sometimes maybe, I need to get bodies in order to retain them. And we know that is a sentiment out there, and we do appreciate you. And Mary, I appreciate you. And can I have the next slide, please? So what I'm going to talk about is just a quick and easy tool to do a risk assessment based on a specific scenario that you may encounter. And we'll see what that has to do, but it's a tool that can be used it can be used really for anything, any kind of hazard you might encounter. So, but first I want to say, okay, I think we all know what a risk assessment is, but the big picture is you're going to use a tool of some sort to identify your health or safety hazards, then take that as a group and analyze and evaluate what the risks are inherent in that situation and determine the ways to minimize or eliminate those risks. Now, I know that we're all doing a facility assessment. We also do, infection control risk assessments, but you can also use them sort of on a case-by-case basis. And that's the kind of tool we're going to show to you today. Next slide, Mary. Thanks. So I just sort of mentioned what some examples are. We do our ICAR. You have to do your annual program evaluation. You can do a risk assessment for kind of anything and everything. Next slide. So here's the tool. I'm sorry if it's a little difficult to read on your screens, but I'll walk through it as best I can, and we'll make this available to you in a blank form that you can use at your leisure. So it's really pretty straightforward. So we've got first the description of what your hazard is. Now in this particular case, we have an unvaccinated resident, so no COVID vaccination, is going out of the facility to bingo twice a week. That bingo takes place indoors. There's going to be more than 5 people, and it's going to be longer than an hour duration for that outing. And there could be potential exposure to COVID. This lucky community has an alert level of low. I don't know if any of us live in a community like that, but if you do, appreciate it. They have a resident vaccination rate of 95%. And a staff vaccination rate of 56%. Now, it doesn't clarify in this. We're going to say that means they're up to date. If you're using a reference, policy reference, or a standard, you could include it here. Then you're going to analyze your advantages and disadvantages to letting this resident go out to bingo. So the advantage is that this person will be able to get outside, enjoy some activities, which leads to improved mental health, start to get back to a normal routine after the last several years, and previous outings have indicated a low exposure risk. The disadvantage is there's that potential exposure risk. So then the nitty gritty is in this grid. That's the severity and likelihood grid. So across the top, we've got the columns are the likelihood of the current situation causing harm. So how likely is it that if we allow this unvaccinated resident to go out to bingo in this specific scenario, that this person will be harmed? And it goes 1 to 5, very unlikely, as in it most likely would never happen, to very likely that we have a documented incidence of more than one occasion at our facility. The rows are the severity of harm if this situation occurs. So you want to consider your risk of injury, need for treatment, financial impact, any kind of detrimental impact that whatever event or situation that you're considering might cause. And it's also a 1 to 5 scale, and it goes from negligible down there at the bottom at 1, which means we don't see any risk for injury or severity of the severity of the risk is low, no treatment required. So if that person was to get sick, would it be negligible? Would they require treatment? All the way through catastrophic, which would be resulting in, we would anticipate a result of unexpected death, hospitalization, or a widespread facility outbreak. So then, as your team, whichever stakeholders that you pull together, which will vary depending on the risk that you're assessing, discuss and agree on, do we think this is very unlikely and negligible harm, unlikely or minor harm, and so on. So this particular scenario, we've determined the risk level is low. The resident, your assessment summary is that the resident's not vaccinated, but he is wearing a mask out of the facility. This person is good at wearing their mask when they go out. There may be potentially unvaccinated individuals at bingo. However, we're able to maintain social distancing. So I would say, it doesn't say in here, that the likelihood is low, unlikely, probably unlikely, rare, but could happen, possible. I don't know that at this point it would be very unlikely, but it would depend on, you would know more about the specific situation of the event that you're analyzing. So, so we're determining that this risk level is low. So then based on that and based on the contributing factors that we took into consideration to make this decision, we're going to write up an action plan. Doesn't have to be anything huge. In this case, they decided they were going to monitor that resident for symptoms. They might consider testing based on CDC, CMS recommendations. If there's symptoms, they might place that person in quarantine and test for COVID, again, based on the current recommendations. They decide they're going to have that resident use mask and socially distance while in the facility when around other residents. And they might put some, what's the word I'm looking for? Clarifiers in there, like, maybe we're going to have a mask and socially distance until we're sure, that there's no symptoms and that they're COVID negative. So you could take this form and you could do really anything. So you've got, I know there's been a lot of talk about when contractors come in. So say we have a plumber that's coming in to fix a pipe, in a specific location in the facility. You can describe that hazard, list out what you think the risks are, and go through this again. What are the advantages to bring that person in? What are the disadvantages? How likely do we think it's going to be that if you're concerned about them bringing COVID in or causing an outbreak, how likely is that to happen? And what do we think the severity is going to be based on, your experience and your processes and practices, and then create an action plan to mitigate that risk. Now, I don't think this would belong in a chart, but that would be based on whatever your document policies are. But I do think it would be useful to keep in the quality, with the quality manager, director, or with your risk management folks, so that you could have it to survey how you're assessing risk if something like that were to come up. I think it would be helpful to keep it around for that purpose. But then that would be up to you and how you manage those sorts of things in your facility. Any thoughts or comments on this? Or do folks use a similar tool and do you find it useful?
I use the same tool and I find it very useful. So thanks for walking us all through it.
I love things that are straightforward and to the point and don't make you fill out pages and pages just to get to an answer.
Yeah, and it's easy to update it too,
Yeah. Yes. Yeah. Lori said she would encourage people to add a row that addresses how the hazard is mitigated. Risk is probability times severity over mitigation. Thank you. You're very technical, Lori. All right, next slide. Do I have a next slide? So this is just a link to a couple of the resources. The Appendix PP has, where the regs address facility and risk assessments. And then off of the cdc.gov. There's a nursing home iCard tool, which I suspect a lot of folks are familiar with. So they're handy there for you. And Maria, yeah, we'll be sending out a blank template so that you guys can use it and fill it in, you know, with whatever situations you're encountering. And I think that's the end. I feel like there was one or two other comments about retention. Let me see what I can find here. And a reminder to fill out the evaluation link. So let's see. Love getting new ideas. Bingo is great too. It's not just for the residents, right? Absolutely. Any games that you can play with them, I think is such a great idea. Addressing issues with low performers or toxic staff as swiftly as possible is an important element in staff retention too. Yeah, Carly, I was thinking that when they talked about resolving, when Miranda talked about resolving complaints, if you want to gain your staff's trust, you have to address things swiftly and fairly. So that's a really good point. All right, any other thoughts, comments? Something you want to get off your chest?
I'll pop in here just real quick. This is Emily from Mountain Pacific. I actually have a social worker friend that does a lot of behavioral health for staff. And one of the initiatives she's trying to implement is actually upon hiring and even with staff that have been there for a while is talking to them about their language of appreciation. So not everybody responds to, you know, gratitude the same way. So what makes them feel valued? And then really kind of keeping track of that and then trying to provide that positive feedback in their language, almost kind of like, you know, you hear about the love languages, you know, what is their language of appreciation and trying to tailor it to them so that it's meaningful.
Yeah, that's a great observation. All right, well, we have another session coming up March 23rd. Carla or Jill, have we determined what those topics are going to be?
I think next week is pneumonia updates.
Great.
Is that right, Jill?
Let me look here. Next week would be pneumococcal vaccine changes and the kindness campaign.
Oh, great. I think we've got the link to the, yep, we've got an evaluation link there in the comments. So if you would take just a second to fill that out, that would be great. And as always, if you have any questions or any topics you'd like to see us address, please don't hesitate to send them either to your account manager or anyone here at Mountain Pacific, and we'll get them on the agenda. Thanks, everybody.